We know that there have to be staff at every level that are interacting with their counterparts across agencies, because that's where a lot of the gatekeeping happens. So that's kind of where we're at.
Great, thank you, Kristin. One of the things that we quickly realized in those conversations about the continuing care reform is that while we were talking about foster children primarily, we recognized the overlap with special education, but we also had to be really clear that not all children in foster care or in any kind of systems work that you all deal with are in fact children with IEPs. And so, Gordon, with your invitation to participate with your lovely voice, would you like to add from the superintendent's perspective?
Sure, I really would.
Yeah.
So I couldn't resist that. Good morning. I think that so much that has been said, I'd want to say ditto because it makes complete sense. And I think also I want to take a moment to take us back in time just a little bit to 2008 when we were dealing with the recession and dealing with just the realization that our economy was tanking. And most importantly, the gift out of that was this full recognition that agencies can't do this alone. And that was a real beginning point when we actually started to do this thing called talk, to do this thing called collaborate, and to fully recognize that what matters most in all of that truly is the relationships and the understanding that there has to be that willingness to make the time as opposed to trying to find the time. In the 41 years that I've been an educator in California, I would agree with Kristin that the momentum is here and that I've never seen this willingness to really work together to make the difference with a very student-centric focus. My concern when I think about just what we're doing, and the state interagency team is a great example of real authentic collaboration. The other piece, just to step that up a bit, I believe is this realization that there may be 633 different things that will make the difference for the youth and students and families of California. But within that 684, we need to whittle that down into something that's absolutely doable. And to actually do this thing called sitting together within the same room, trying to get in the same book on the same bookshelf about what to do with the 25 or 30 things that we identify. That's critically important. Some of the other things that I've noticed in terms of just where I think our collaborative efforts ring true is this understanding of student mental health and how that's so critically important. Is an understanding and a common understanding about attendance. And through the help of the state interagency team, the department's made a big deal about chronic absence and attendance, and other agencies have messaged for us to let it be known that regardless of all the resources and efforts we're trying to make, that falls short if the student's not sitting in that seat. There's a new awakening to the idea of equity versus equality, and what does that mean? And I think that's yet another opportunity for us to sit together and make sure that we're all on the same page about that distinction, and then looking at what is it that we can do. What is it that we can do for the 100,000 or so foster youth, that are within the state's charge, with the full understanding that what's good for them is good for everyone else, and how we can learn via, I think, that vehicle, better ways to collaborate, better ways to do good things. We collaborate greatly with corrections and the Bureau of Corrections and the Chief Justices keeping kids in school and out of prison, because that trajectory is a harmful trajectory. That is a concern. And I think it's important to call it out and say it's a concern, particularly for students who look like me, students of color, who, as we have these conversations about meeting the needs of our kids, I think we would be remiss if we're not looking at equity, looking at specific needs, and then addressing those. And I think that we're at a place, and I'm excited at the idea that we're here having this conversation, that you are here with this real clear sense of how do we do this together, because together is indeed better, and most importantly, how do we ultimately make the difference? And that's a great step in the right direction. I may share more later, and I'm sorry for those that I
Yeah, you
can't
can't see, yeah.
Hello. Good.
Thank you, Gordon, and that really provided me a great segue for Ellen Nance, because we all serve children who come to us through various doors, and many of the children come to us through the door of probation, but not all. And the issue of equity and race has become more and more a prominent issue. So I open the questions to you, knowing that that focus is part of our ability to attempt to address disparities and equity in a new way.
Well, thank you very much, Maureen, and good morning, everybody. I'm really pleased to be here this morning to share some remarks with you, and I see some great friends out in the audience. Amy there from Zellerbach, one of our great partners in San Francisco. I was sitting here amongst these distinguished folks here at the dais, and I'm thinking, what do we all have in common? I'm seeing all of these state agency representatives, and I don't represent a state agency. Mm-hmm. I represent the Chief Probation Officers of California, which is an association of Chief Probation Officers throughout the state, and I obviously represent San Francisco as the Chief Probation Officer of the Juvenile Probation Department. I like to think that San Francisco really loves probation so much that we have two probation officers, an adult probation chief and a juvenile probation chief, whereas in the remaining 57 counties, there is one chief probation officer. But the reason why I think the Chief Probation Officers of California got invited to be at this table is because of the commitment to collaboration within the Association of Probation Chiefs throughout the state, but also within our counties and the counties that we represent. And I think it's really important that probation be at the table and not hunker down in our bunkers and silos, because the work that we do cannot be successful without the partnership of our partner agencies at the county level, at the state level, and also with our communities. And I will tell you that when I think about collaboration, as you've heard already, I think about the relationships and how important those relationships are. I think about structurally creating opportunities to have face time with our partners. And sometimes we don't do that. Sometimes we don't want to do that, but it's necessary. And I also think about how complicated it can be to develop the level of collaboration and partnership and coordination that's necessary in order for our systems to work together on behalf of young people. In our juvenile justice system, we've seen some tremendous successes over the last decade. We've significantly reduced the number of young people in our justice system. That's not just because of what probation does, but it's also because of what all of you do. It's because of what the school district does, what our mental health providers are doing. It's because of what our child welfare agencies and partners are doing. And yes, it's because of the work that our community-based organizations are doing. So I can give you an example of where collaboration has worked really well for us in San Francisco. Joint funding of our community-based agencies, where probation, the health department, our school district, we sit together and come up with ideas and suggestions and financial commitments, blending funding, sharing ideas, sharing resources that fund the agencies that are doing the work on the ground. That means we have to give up a little bit of our control. We have to give up a little of our influence. But what we get in return, the benefits that come as a result of being willing to let go of some of our traditions, is a better system that works more effectively for our young people. That is about trust. That is about a commitment to youth that is greater than our individual agencies. It is also about a willingness to come to the table, to have the difficult conversations, and to be accountable to each other for our collective success. It is also about inviting people to the table that traditionally didn't have a voice. The youth, the families. And I remember when we first started having conversations about inviting these non-traditional partners to the table. Folks were, oh no, you can't do that, Chief. That's just going to be a problem. It is about them. It is for them. And therefore they need to be at the table. But that is a shift in the paradigm. It is a shift in the way we think about partnership. Greg talked about the work that is happening at the state. I'm in as many meetings these days with Greg as I am with my local partners, because we are listening to each other. Greg talked about CCR and the continuum of care reform efforts. And it's hard work. It's difficult work. But unless we're having those conversations together, and unless we are planning collectively, we cannot be successful on behalf of our young people. And so when I think about collaboration, when I think about the effectiveness of our partnerships, it has to go beyond the words. It has to be in our deeds and in the way we talk to each other, in the way we come to the table, in the way we show up, as all of you have done here today, to be present, to understand how we can do it better. You know, in 2005, I was brought to San Francisco from Chicago. Shortly after arriving here, I joined the then Mayor Gavin Newsom's administration at City Hall. And I recall sitting in a meeting with him in his office. And at the time, I was leading his mayor's office of criminal justice. And one of the things he said to me was, Alan, we must do better. It doesn't matter if it's housing, if it's homelessness, if it's juvenile justice or child welfare or behavioral health. We can do better, and we must. And that has always resonated with me. I've always thought about those concepts and those ideas and those basic conceptual premises of seeking to do better, bringing trauma-informed systems into our city, not just a department, bringing that to the city and all of our agencies, thinking about developing a council that the voters have agreed to in San Francisco to develop a framework for the health and welfare of young people in our city. That takes bold, creative ideas, and it takes leadership. And so I don't want to monopolize the time here, but I'm really looking forward to sharing more ideas with you about some of the things that we're doing locally, but I also want to share with you how incredibly committed probation chiefs are across the state to move outside of their comfort zone, to develop partnerships with agencies and organizations and individuals that are focused on a singular goal, which is to improve the lives of young people in California.
Amen, and thank you. Anna, you have the opportunity to work for the Mental Health Services Oversight and Accountability Commission, and this, as you all know, is a group that was formed to make sure that the dollars that are coming out of the proposition that was passed now years ago actually support prevention and early intervention in ways that were originally intended. And so you also actually provided us some slides for your conversation. I don't know if I need to monitor them for you, but can you address your questions?
Yeah, so I did bring the slides because I wanted to show something at the end.
Oh, you need a mic.
Oh. Can you hear me? Okay. Yeah. So I think that in our work to start with MHSA, the values that are laid out in MHSA are really important values that we've talked a lot about here the past day and a half. The value of prevention and early intervention, and really working with very young kids is kind of at the core of MHSA, and also the value of innovation and trying to transform the system. So we've talked about that a few times. One of the things that is not, I don't have listed on the slide, but in terms of collaboration, the community planning process that's central to MHSA is really an opportunity for collaboration at the ground level, and it's the expectation of the planning that all the funds are come from a groundswell of what the community wants. And so I think that's really important to highlight.
Okay.
So I just wanted to mention that I don't think that there's a lot of clarity about how the state can collaborate or should collaborate with one another. Because we have the funds, most all of our funds go directly to the counties. State collaboration happens kind of spotty, but around certain projects, and I think that's what we're talking about here. Next. Here's just, I just wanted to mention again the different systems that we find kids and families in. Go ahead. So in terms of current projects, our policy projects are at the center of guiding collaboration across entities, across state entities, county, and with the community. So we have 4 policy projects. The first one that we did was around criminal justice. The current one, well, there are 3 current ones that are going on. Kai over there is working on a school mental health policy project, which has established collaborations with the Department of Education and some other entities. We have Children's Crisis Services collaboration, suicide prevention, and I think that the value in those collaborations, you know, the policy projects, we have recommendations that come out of them, but really the process of writing those projects, of gathering people together and developing a shared understanding of what the issues are in each of those topics, I think is really important. Of course, most of you know about the triage money. There's description about how the triage programs in your brochure, and so I won't go into that. What I will say is that you know, we intentionally incentivize collaboration with these grants, and there are 4 counties that got increased funding for having established and demonstrated collaboration efforts, and that includes shared governance and shared policy. You know, the collaborative partners in all of the grants range from law enforcement, hospitals, schools, jails. We had one that was collaborating with the taqueria, and so I think that those are really important too.
And I don't mean to interrupt you about that, but isn't there also a piece in that grant proposal that asked that there be demonstrated replicatability or some responsibility for the grantees to help other counties do similar work?
Yeah, so the idea was in the 4 that those be demonstration projects, and that we use the learning to then be able to disseminate and then create shared learning. Oh, and so part of that is also we have quarterly webinars with all of the grantees to provide an opportunity for shared learning. Yeah, thank you.
Thank you.
I wanted to mention the Innovation Incubator, which is something that's coming. We had our Innovation Summit in February of this year, and the Innovation Incubator is really an opportunity to get together different entities and do innovations around mental health, which is exciting. Workplace mental health, we're working on developing standards for workplace mental health, and that's going to be a private partnership, but one of the things that's come out of that is that we're starting to, in fact myself, I'm starting to train other state entities on mental health first aid. So I'm going to be training Cal HR next on mental health first aid, and I think that just will start to create a community of people who understand mental health better. Next slide. Second, just wanted to mention that there are opportunities around around each of the 7 negative outcomes that are outlined in PEI for data sharing, and so data sharing, I think, is a really foundational way that the state entities can start to collaborate and really understand where our systems are. And then last slide. So this was something that I wanted to show you, and it's actually being debuted, it was yesterday, to the commission. We're, in the next couple of months, we're going to be unveiling our programs, providers, and services transparency webpage. And so all MHSA programs in the state will be searchable on this webpage. It's similar to our fiscal transparency page that you may have seen on our website. But this is an opportunity to be able to look up, you can search, child services or Riverside County or CBT, and all programs funded by MHSA will be available. And I think having that transparency and access to information is gonna really help with collaboration moving forward. Yeah.
And can I ask you, I believe that the intention was that we would be able to put all these slides on our website so that people will be able to access all this information.
Yeah, and this is just a screenshot.
Right.
Yeah.
Well, thank you. So yesterday I had the opportunity to walk around and listen to our counties during their conversations about how they could continue this work. And one of the things that I consistently still overheard were conversations about barriers. And this conference is all about breaking barriers and building bridges. So number one, thank you again for everything that you've brought here. But if you could now move on to how you all are building bridges, or how you see taking this great collaboration that's happening at the state level, and here we have a group of people who are all at the local level, how do we make sure that that gets together so that everybody can do what they need to do for children, which is why we're all here?
So if I could just jump in a bit. So a couple of things come to mind when you mention that. At the kind of the tail end of the administration that's winding down, a number of the departments within Health and Human Services have been getting together to work through as Erika said, we struggled to figure out how to each other's language. We also have been doing lots of work with local government on problem solving and identifying issues. And so a group of senior leaders have come together in the Health and Human Services Agency to first to provide kind of clarity around programs and eligibility criteria and who pays for what and all that kind of stuff to help local collaboration. But also we feel like that's an entity. It's even though it's in its nascent stages, and where local government and others can bring some of the issues that they're grappling with to the state to the degree there's guidance needed from the state, from thought partners, from state folks, figuring out how to maximize, funding opportunities or whatever it happens to be. There's a nascent kind of organization forming within Health and Human Services to kind of to support local collaboration. And then frankly, there was a bill passed recently that kind of codifies that as well. It requires local governments to have a number of MOUs in place, and it requires similar within Health and Human Services Agency to have MOUs across these various departments to work better together. But frankly, to me, you can have MOUs, but if they're just going to be on paper, then you've got, paper with lots of signatures. We really have to kind of walk that walk, and we have to do what we said we would do, and be actual, real legitimate partners, not just from a kind of an oversight standpoint, but from a technical assistance thought partner standpoint, from a shared risk and shared responsibility standpoint. And frankly, I would say that one of the ways that you all can enhance some of the collaboration across the state departments is to bring issues to us, be willing to partner with us, and hold us accountable just to do the work together. And I think that that goes a long way. And I would just say we've been trying to do some modeling too around, I think I was saying earlier to somebody that I think two things often around collaboration. One is if you look at the word, in the middle of the word, it's labor, and so collaboration ain't easy. And it often is easier for us to sit in our little bubbles and do the work. But collaboration it requires work, and I think those of us up here are committed to work with you on grappling with issues that are make kids and families' lives better. And the other thing I often like to say that sometimes gets me in trouble, especially with some of my bosses and our fiscal people, is that I really feel like collaboration where you need to check some of your ego at the door and put your wallet on the table. And so I think we really have to think about how to do that better, and I think I for one would be interested in having additional conversations with you all over time to see how we can best do those things.
I have to say I love your reference to putting your wallet on the table, because it's been over 30 years since Rick Saletta and I in Placer County said not only do you have to put your wallet on the table, but you have to put your hands behind your back and make sure that the money gets to the kids. Thank you very much. Alan, you mentioned you have several ideas that you wanted to share.
Thank you so much, absolutely. And so this whole notion of collaboration, I would just encourage the folks in the audience here today to ask yourself, within my county, do I know the folks in the other systems? Do I know the leadership within those other systems? Am I having conversations with them on a regular basis? Are we planning together? Because if that is not happening, having conversations about partnership and collaboration at the state level is far more difficult. There has to be meaningful engagement at the local level in order for systems to work effectively across county and state levels, but certainly across other systems. And I know that's not happening everywhere. And I know a lot of the folks in the room today want that to happen. So I encourage you to have those conversations with the leadership within your county to say, how can we build collaboration and sustainability of these partnerships across agencies? How do we share data effectively? And we've had some tough, knockdown, drag-out fights about sharing data in San Francisco. But we got to the point where we built a shared youth database, where the school district, probation, child welfare are feeding information into the same system. But we had the tough conversations. And so sustainability of collaborations, and I think you heard it here today, it is not just about the MOUs that you develop, but it is also about how we operationalize it, how we put it into practice, how the integrated core practice model becomes the way we think about the work that we do. And that's about commitment. It's about personal commitment. It's about county level commitment. It is about our agency's commitment. And for some of us, it is a change in the paradigm. It is a different way of thinking about how we do the work. It is a different way of viewing our responsibility to the collective achievement that we seek. And that's messy. It's complicated. It's burdensome. But it is necessary. And so when I think about the systems that work in our community, it's the systems where these concepts permeate the agencies. It is where we are collectively planning and coming to the table. It's where we're thinking creatively about how to fund a need, how to bring philanthropy to the table. Because you know what? They've got great ideas as well. but it takes effort. But I just want to encourage everybody here today that collaboration can work. It can work at the local level. It can work between the locals and the state. It can work with our communities if we're willing to put in the effort. And I think the folks that are in this room today, you're here because you recognize the obligation as well as the opportunity to build that level of collaboration. You know, I met Elizabeth today for the first time, and I'd like to think that she'll be my new BFF because I was so inspired by what she shared about how she got to where we are today. In this effort to remove barriers so that young people get what they need, so that equity prevails, so that better outcomes can be achieved. That is about partnership. That is about bringing people together. And it happens over lunch. It happens in conference rooms. It happens in a variety of places. But it doesn't happen unless we commit to it, unless we're willing to do that work. And these systems that we develop and the level of collaboration that exists across our agencies, it is not a destination. That is a journey. It is an ongoing journey. And it's something that we have to continually put the work in to keep those relationships fresh. We know there are transitions. We know that people retire. But unless it is systemic, unless it is built into the fabric of our organizations and our counties, it's hard to sustain. And so I just had two great partners retire. Sylvia DePorto, if you know her, she's a wonderful lady at our Human Services Agency and Child Welfare. Ken Epstein, who was in our Public Health Department.
And on our committee.
And on the committee. These are huge folks in our system. But they left behind a legacy that valued collaboration. That's my obligation in my organization, so that when I walk away, that folks are prepared to continue to move it forward. And when we do that, young people benefit.
We just have a few more minutes left, and I want to make sure everybody has a chance. And Gordon has said, I'm ready.
Well, I just wanted to take a moment and build on that with something that I think, if somebody gave me the magic wand and said, go make it happen, one of the things I'd like to do, I think it's threefold. One is to have agencies in the company of foundations and nonprofits and anyone else pool resources to have 3 convenings, a North, Central, and South convening. Prior to that convening, really providing guidance and direction on locally what needs to happen collaboratively locally so that folks can come together and help shape the agenda for that convening so that there is this collaborative thinking about what needs to happen. And then thirdly, in those convenings, having very dynamic facilitation so that within those discussions, that facilitator can stop and say, and what does that have to do with actually doing something when it comes to making the difference? So that it isn't about talk, it isn't about more words on paper with MOUs and all great, beautiful signatures, but it's about doing. And I think if we invest, pool those resources to make it happen, and then make sure that it happens in a very succinct and doable way with a clear understanding of what are not only the anticipated outcomes, but what are going to be the outcomes, I think it could make a huge difference.
Great, thank you. Erika, would you like to address that?
Sure, thank you. I don't want to repeat what everybody said, but those were some of the things that I would say too, with an emphasis on what you said a moment ago. Do you know your partners in your other agencies? And that sounds basic, but we find that sometimes that is the case where people aren't communicating and don't know each other as well as they can. And when they come together and talk things out, it really, some of the barriers that are perceived to exist really are not barriers or misconceptions. Somebody said mythology, I think it was you a minute ago, where there are workable solutions out there if people are willing to communicate together. Greg mentioned a recent piece of legislation a moment ago, which was AB 2083, that requires the MOUs and the partnership of various state agencies, including those that are represented on this panel right here. Fortunately, we're doing a lot of that already, even prior to when that law passed. So I think that's a great opportunity to build on those partnerships and problem resolution functions that we've been jointly working on for many years now. And then I wanted to focus a little bit on data for a moment. The data, sometimes we are trying to conceptualize a problem or describe a problem and don't have the data that we really want or need to be able to really address solutions for that. And so something that social services and healthcare services have been working on recently is a major data matching effort to understand the referral process, follow a child through a referral process, for example, from child welfare to mental health services. What's happening with the child? Is the referral getting there? Is the child accessing services once they get referred, et cetera? So these are kind of new efforts, and we hope will generate some good data to work from to better understand problems and better address problems as we go forward.
Super, thank you. Kristin, how about you?
Well, selfishly, I'd like to see schools really be the true hubs, and that we're really wrapping ourselves around where the people are, the families and our kids, and making it, these are all adult problems that we're talking about today, and really for families, we need to make it as seamless as possible, and I think that is really the true challenge, is how do we make those access points so easy that we're not leaving anyone out. And in special education, we do have the advantage of having IEPs. However, we know the intersectionality between that and many other things, including the fact that 70% of our kids that have disabilities or on IEPs are also in one or more of the LCFF subgroups. And so we're not talking about different sets of kids, we're talking about kids with multiple needs. And I have the opportunity to work closely with the Director of Department of Rehabilitation, Joe Xavier, and he is a man on a mission about one person, one plan. And I think that really resonates because I heard you talk about just sharing the information in San Francisco. I know there's some fear about big data, but the reality is that the only way to make it seamless is to truly have one system. And we have all the will right now. We just need the mechanism and platform to truly have that one system, so that when we're all talking about the same child, that we have the ability to truly know all the services and supports that are happening with them. And when I think about even my own situation that does not involve behavioral health for my own children, we have sometimes 4 or 5 case managers for one child. And that's not an effective use of time and people. And often all those folks are not even at the same table, even around the IEP. So I think articulating, really going back to center and focus on that whole child idea. I know it's basic, but looking at that whole child and looking at the school as that hub, to me, is super low-hanging fruit. And we as adults can coalesce and figure out the system around that, but we need to meet people where they are.
Thank you, Kristin. Anna, do you have any last comments? Yeah, I knew you planned on doing yours completely. We are about to take a break, but I'd really like to invite you to thank our panelists here for their inspiration and opportunity.